everyone, I'm Graham McGinnis, an AST and helicopter rescue swimmer at Coast Guard Air Station New Orleans. AST stands for Aviation Survival Technician, and we compose one of 4 elements of a Coast Guard air crew. We're also qualified emergency medical technicians. It's our job to pull you out of danger, get you safely aboard the airplane, and treat any medical emergencies in flight while we get you safely ashore. Now, most people are familiar with the images of rescue swimmers jumping out of the helicopter or seeing survivors hoisted in the basket out of the water. But what you don't get to see is what happens in the back of the plane. When it comes to getting a survivor out of danger into the safety of the helicopter, oftentimes we'll use the Stokes litter, like the one you see here. Once we get you inside, there's a number of things we could be doing depending on the situation. It could be anything from someone whose vessel sank to hypothermia, amputations, and more. There are a number of tools and equipment at our disposal to effect a successful rescue and keep you alive. Some of the medical equipment that we carry on the aircraft include an automated external defibrillator, which we'll use to correct an irregular heartbeat. We have our standard emergency medical technician kit. This includes the gambit of equipment that you would need for most medical emergencies. We have supplemental oxygen, an airway vacuum, a bag valve mask, some advanced airways. We have a tourniquet, bandages, pretty much anything you need for most medical emergencies. This is our standard kit, go-to for most all of our cases. We'll bring this down with us, take vitals, get everything started, and package the patient up to get back up to the aircraft. We have some supplemental kits as well. We have an endurance oxygen pack. We'll use this. We have longer medevacs that sometimes are a couple hours long, and we need to make sure that we have enough oxygen to cover that entire span. So we have extra oxygen here. In our burn kit, we have extra saline, burn gel, bandages, emergency blankets, keeping the patient warm during burn emergencies. And lastly, we have a pediatrics kit, and it's pretty much everything you see here. We've just sized it all down, and everything fits and is appropriate for children patients. So as you can see by our equipment and our skills, it's the AST's job to act as a bridge, taking someone who desperately needs help from wherever they are on the water and helping them get back to land to receive the treatment they need. If you'd like to keep up with what we're doing here at the air station, visit us on Facebook at U.S. Coast Guard Air Station New Orleans.